she needs to talk to somebody, and she won't. So anyway, so we'll talk about, so catheters are used in several situations. One of them, yes, actually, there are some surgical procedures where you can take a piece of colon and basically form a bladder.
Yeah, it's cool.
That's done with people who have had extensive bladder cancer and had to have their bladders removed. But it does work. But really, it is mainly used for people who cannot pass urine for one reason or another. Urinary retention is, of course, one of them. And so they can be, yes. I don't know. Any tissue can get cancer, so I suppose ureters can, or urethras can. But that's a good thought. I have to think about that. But there are a lot of reasons people can have urinary retention. One of those reasons can be prostate problems that are just really cutting off the urethra. There are other things we can do to make that a short-term solution. We can open up the urethra. We can deal with the prostate. We can put a stent in the urethra to open it up. We can do a lot of things. But post-surgically, it's not at all uncommon. Anyone who cannot get out of bed will be catheterized. Yeah, well, it's and sometimes just recovery from surgery means you're not ambulatory. Anyone who's actually goes into surgery requiring any sort of anesthesia is likely to be catheterized, because the last thing the surgeon wants is for you to be voiding onto the operating table. So we'll do that. There are occasionally someone might catheterize a patient for some bizarre reason to get a good urine sample, although the clean catch that we talked about is just as good, really. Sometimes we will catheterize someone to look at bladder capacity. But what happens then is you fill the bladder and then let it drain. Okay. We may want to collect urine before a surgery, and we would catheterize then and leave it in. Or in seriously ill patients, we will do 24-hour outputs by catheter. So there's lots of reasons we might do that. For the most part, working with patients, you're going to be working with patients who, for one reason or another, cannot pass urine or cannot get to a bathroom. And bedpans, although they are far less prone to things like infection, they're really a pain to use. And besides, they always come out having been feeling like they've just spent the last week and a half in the freezer. So they're not very comfortable. So there's lots of reasons we might do that. The worst reason is for the convenience of the medical staff, because catheters that stay in place more than a couple of days start getting very much prone to infection. The leading cause of hospital-acquired infections is UTIs related to catheterization. Some 40% of all hospital-acquired infections are catheter-related. Yep, and you don't want that, because what happens is that the infection starts traveling up the urinary system and ultimately gets into the kidney. And then you got problems because it can kill a kidney. Or dialysis. We have a young friend who's 36 years old. And he was admitted to the Medical Center of Northern Colorado in Greeley. Now it's almost 3 weeks ago, with suspected kidney and liver failure.
They usually have hospitals?
No, it was a Banner facility.
Oh, yes,
Yeah. So this is a young man who does not use any sort of drugs, licit or illicit, does not drink alcohol. So liver and kidney failure at that age are, while not unheard of, very unusual. Yeah, they apparently catheterized him because he was in intensive care for 2 weeks. They apparently catheterized him and came out with a boatload of pus. So he looks like he probably started with a UTI. He's a person who will not complain of pain, very high pain tolerance. He'd been telling me for a couple of months that he was having back pains, and we were talking about seeing doctors and getting tests and stuff, and I don't think he was doing it. And it turned out that the infection had become systemic. He was septic, and it had gotten into his joints. They had to drain 11 joints. He is one sick puppy.
Yeah.
He is on dialysis now. They hope his kidneys will come back, but because he's fairly healthy. I mean, other
Right.
than this,
Yeah.
but yeah, he should. We're hopeful. I know you can live with severely. Pardon? Do they have what? I have no idea about that. Right now, he got moved out of MCNC and is at the Johnstown Rehab Hospital.
Well, he and our boss are probably not agree on this. He should probably get on one.
He's working with these people. I would assume that that's the case, but I haven't actually. He's still a bit out of it, and I haven't asked his parents that question. But thank you.
Because those like can be listed one.
Yeah, he's doing dialysis 3 times a week.
Yeah.
Yeah.
But you want to be on it just in case you don't rebound.
Well, we're seeing what's going on. His creatinine is coming back down to normal, which is good. That would indicate that his kidneys are recovering. But he was really, really ill. You can imagine. We were all worried we were going to lose him. Yeah.
He's so young.
Yeah, he's way
And
too
just
young
when
for
you
that
see it, I
crap.
could have checked him out.
Yeah.
Which is, that's why I actually one of the reasons I got into medicine. Is because to me, the way I explain it is the beauty of the body is it can take on one hell of a beating.
It can.
But at the same time, something so small and simple as an allergy to a flower can take you down.
Mm-hmm. Yeah.
So it's just that polar oppositeness that just kind of sucked me in.
Yeah.
Outside of the fact that I took care of my mom when I was from 16 to 19, before she had her gastric bypass. I had to take care of her. She was morbidly obese, about 600 pounds. So I was bathing her, getting her meds, grocery shopping, paying bills, taking care of my sisters, doing everything. And I really enjoyed helping my mom, taking care of her.
Right.
And I wanted to continue that. So I actually was in the field for quite some time. But then I ended up leaving Caring Hearts.
Caring Hearts, okay.
Because I found a job at Teletech that paid more. And I wasn't driving because half my check went to gas.
Yeah.
And I still would make more driving from Fort Collins to Greeley every day. I was still making money, and I needed the money. So.
And most days that drive isn't real bad. It takes a while.
Yeah.
It's not a bad drive.
You know, my passion is medical.
Oh, good.
But I gotta support my family. So
Yep.
that's my passion, to pay my bills.
And now you're pursuing your passion.
Sure.
Excellent. Pleased to hear it. Anyway, there are several types of catheters, and they come in varying lengths and shapes and sizes and everything else. We've got
material.
And different materials. Lately, everything is latex free these days because so many people are allergic to latex. The official statistics are that 12% of medical personnel are allergic to latex. My personal polling would put that at least 3 times that level. I'm allergic to latex. And so, you know, I just really, looking at all of this and talking to our friends in medicine, latex is nasty stuff. So we've got straight catheters. These are the most commonly used. They can be used. They can be used in men or women, but they are mainly used in women now. They're especially used in women. We have a curved, Conde catheter is slightly curved and is found to be better for males for, I think, obvious reasons. And finally, we have the Foley, which is what we use when we have an indwelling catheter. The other 2 catheters are generally used for short-term use. They're used during surgery. They're used to when you need just a short-term visit with a catheter. There are other designs. We have condom catheters, which the name makes it pretty obvious how they work.
Over your penis.
Yep, it fits right there, and so it's not an indwelling into the bladder, so they can only be used where there's no urethral blockage. Yeah, pretty much that. It's it is. So the Foley is inflatable. This little balloon here, after you put the catheter in, you inflate it. And that inflation keeps it from pulling out of the bladder. No, not in all cases, because the inflation sometimes fails. And I bet his scream can be heard in the next county. Yeah. I heard a horror story about a straight catheter one time in a military hospital. Somebody was not properly inserting it, and it folded inside the penis.
Wait, explain this to me one more time.
The tip, so not a Foley, it was a straight. And so it was going in, and somehow or another, it folded, so double back on itself. They didn't. They pulled it out, ripped it out, and I thought, that's pretty damn stupid, because you would just push the whole thing into the bladder, let it straighten out, and pull it back out. But oh no, military doctors are not that way. So, yeah. But anyway. Yeah.
Well, yeah, that would hurt, but it's not going to do damage. Ripping it out that way can do.
It can do a lot of damage. Yeah, you're gonna. It was apparently, again, it was a scream that could be heard in the next county. But we also can, if we can't put in a normal catheter, we can literally go through the abdominal wall straight into the bladder with what we call a suprapubic catheter. So this, pardon? That's this thing right here. You see this little structure that is flattened when it's going in and straightens out into these little triangular shaped things, right? That keep it from pulling out, okay? And then we can permanently install a catheter in patients that really need to have it permanently installed. Then we're worried constantly about infections. So we're constantly flushing them. You've seen the the big 60 milliliter syringes. Those are not for giving shots. Those are for flushing catheters. And you need, if you're going to leave a catheter indwelling for any length of time, you need to be flushing it regularly. Catheters should come in sterile packaging. So you should, inserting a catheter, you should put on sterile gloves. And in your asepsis class, you learned about how to put on a pair of sterile gloves. Sterile gloves are unlike the ones in the lab. They're actually handed. So they are actually marked left and right-handed so that you get the right one. Each one is in its own package. It's sterile.
And if you try to put the wrong one in the wrong hand, trash.
It's trash. That's right.
Can't leave it in your hand alone.
Yeah. And they are sterile, so you have to learn how to do that. So what happens with these things is they're latex. We lubricate them. We lubricate them with a little bit of KY jelly and also lidocaine gel so that we can, basically numb. Some urologists, when they're doing certain procedures in the bladder, it will insert things after they give a little lidocaine shot in around the opening of the penis or the woman's urethral opening, because apparently they're pretty big and they're pretty painful. And I know this because I have a friend with bladder cancer who goes in periodically, and that's what he has to do. And I shudder every time he talks about it.
They told him that, when he his bladder was within the next few days. And he was excruciating. We're monitoring his urine output for the last 2 days of his and did physicians that his heart facility don't do that.
Mm-hmm.
So
Like,
good.
I don't blame him for his choice. I would probably do the same exact thing.
I'm just glad we got the option now.
If
Yeah.
I had a terminal cancer, I knew it wasn't doable. I was on the stage. Like, no.
Were you literally waiting around to die, watching yourself waste away? Yeah, I think you should have the option.
And I think he was around 65 to
Yeah.
70. He's still pretty young.
Yeah. And that's not a terribly young age for bladder cancer to appear. So say we have a friend who has been being treated for bladder cancer for quite some time, and he's done some chemo, but now he's done a mixture of dietary control and natural medications, and his disease is controlled. So it's fortunate because he's a good man. Yeah. And who knows, we was telling you about a friend of ours with prostate cancer. They gave him 6 months, and he's still with us. By now it's 15 years later, because he aggressively sought experimental treatments. But we have another friend, unfortunately, who about a year ago started getting treated for pancreatic cancer. And I just had coffee with him yesterday. And he told me that he had finally just stopped taking the chemo because the chemo was wiping him out. And the cancer had metastasized to liver and lung. So he's, at this point, waiting to move on to the next world. So.
No, my uncle Art died from cancer. I don't remember if it was pancreatic or it was one of the really bad aggressive ones, and it wasn't down till stage 4. and metastasized. He died within a month.
Yeah. We had a friend who went through breast cancer, was cured, and they were on their way down, driving down to Phoenix, and she just randomly did a short, palpation breast exam, and her cancer had come back, so she went through that torture again with radiation and chemo and was cured. And the third time she said, nope, I'm not putting me or my family through that again. So they said, well, you've got 6 months to 2 years. 2 weeks later, she was gone.
Wow.
She decided, I'm out of here. And the only reason she lasted 2 weeks, we're convinced, is because one of her daughters was in China and had to get home. And that was it.
That doesn't surprise me.
Yeah.
It
The
happens.
circumstances are crazy, honestly, like, and he was told, yeah, 6 months or less, your friend, same thing, but, the difference is the cards you want.
Yeah.
Well, my uncle Art was so angry. He made it to where we couldn't go see him there at the end because he was wasting away.
Yeah.
He went from his normal weight down to like 70 pounds.
Ooh.
His skin was deteriorating, the whole nine. It was awful.
Yeah, I bet it was.
And at that time, we didn't have the law we have now. So he couldn't stop.
He couldn't say no.
Right, he couldn't be like, let me go ahead and end this now. And I wish it would have, because I could not imagine watching myself literally rot.
No, it's really hard for family and for you. It's worse in many ways for family because you're inside it and it's just, it's happening. So anyway, let's keep going. Catheterization. You have two different procedures for men and women. Obviously, the anatomy is different. So the penis has one opening. That's easy. The female anatomy actually has a couple. So you have to know which one you're aimed for. And it's pretty obvious, actually.
If you don't.
Yeah.
How exciting is that holiday one?
Yeah.
Yeah.
Tiny one at the top. That's the
Yeah.
one you want to hit.
It's the tiny one at the top is the one. So we, in all cases, everything is sterile. And you have a kit, you should be able to open it. Everything comes out sterile. Everything you need should be in that kit.
Why does it say that?
Because you're going to use one pair. A lot of times you use one pair to clean up the patient and the other pair to actually insert the catheter
The first one,
in the room. Yeah.
then we have sterile gloves that come prepackaged, that you have to rip open and carefully put on.
Yeah.
They're sterile.
Yeah. So
Well,
we,
probably
yeah, this
Otherwise
is an opening directly into the body. And so what we're trying to do is be careful that we do not introduce anything into that opening on either gender. So you have all the equipment you need and you follow the procedure. We will not go through that. We've got too much other stuff we need to do. Yeah. But you have videos of those procedures, and I suggest you watch them. They're actually very well done videos. I looked at them the other day and said, yeah, if we don't have time, we'll just make sure that everybody do this, watch this, because the procedure really, you need to follow the procedure always. So you actually, you gown, you wash, you take care of everything. If the patient is conscious, you explain what's going on. If the patient is not, well, you don't. Patient is always lying on, the female patient is lying on her back. Male patients can actually be sitting up for this. But you drape the area and wash everything. You use both cleaning wipes and povidone iodine, betadine. Because you really are, there are so many bacteria. And you really want to be careful not to introduce anything. So the whole thing, you have to follow this procedure, and it's a very precise procedure for cleaning and then holding the labia apart while you gently insert this tube that is now covered with the KY gel and the little bit of lidocaine gel to numb it up as it goes in, because it really isn't very comfortable. I can tell you that removing a Foley from a male tickles. That's all. But I wasn't conscious when it was inserted, so I have no idea what it felt like going in.
Okay.
So, but, pulling it out, they just have to make sure they deflate the balloon. And then it just pops out, and all it does is tickle. So, kind of.
Actually, they had to reinsert one because
Honestly, removal of is very similar to delivering a baby.
I don't think so.
Oh, I do.
Not even close. But then
I'm
again,
like, honestly, like once the baby comes out, it's like you feel so much pressure, and then it's just like kind of like relief.
Yeah.
And that's how it is.
I feel you on that though,
Yeah.
because there's a lot of pressure in a 6 stretch down.
Yeah.
But I didn't care because, I mean, the first time I woke up and I was like sitting there and everything's fine, then I think something happened and something got changed, switched, whatever, something moved. And I had to pee. And I'm like, ding, I gotta pee. They're like, you can't have to pee, you're catheterized. I'm like, I gotta pee. And they're like, no, you don't. And so they left. And I'm like, I gotta pee. I gotta pee. I gotta pee. I gotta pee right now. Or I'm gonna pee on this bed. Like, you can't pee on the bed because you're catheterized. I was like, well, something's gonna happen. And my bed's wet. So, and they're like, what do you mean your bed's wet? And I'm like, what? And then they're like, something's wrong. I was like, you think? So then they checked and the catheter was in wrong, so they had to take it out, reposition it, put it back in. And when they put it back in, it was like the whole bag just filled up with pee.
I bet it did.
I was like,
Yeah.
I told you.
So one of the things that you have to be is gentle. You don't want to work too slowly, but you also don't want to work fast, and you never, ever, ever force a catheter. If there's resistance, something's wrong. So you pull it out.
You don't yank it out.
Pardon?
You don't yank it
No, you don't yank it out. And if it doesn't come out easily, that's when you say, okay, let's bring in the team. Okay? Yeah. Males are much the same. There's a video on that as well. When you're doing a female, all the stuff is on the bed, right distal to her vagina, where it's right where you're going to be using it. With a male, you're going to have it on a Mayo tray next to the bed. And so you drape, you clean, and you very carefully insert the catheter, holding the penis fairly straight so that what's going in is not negotiating curves or anything else, because they're flexible.
Would you want to hold the penis as close to the body as you could?
You really want to hold it right next to the glands, the tip, the flared part of the tip of the penis, because you want that sort of stretched out to make sure that opening is as straight as possible, that pathway. is as straight as possible. So again, you follow some steps for cleaning, and you insert it, and you keep inserting. In both cases, you keep inserting until in the men, 6 or 8 inches of the catheter is inside and urine starts flowing. Women, it's 5 to 6 inches generally, because their urethras are shorter than men's. Again, for obvious reasons. But you insert until urine starts to flow. At that point, you're in the bladder. If it's a Foley, you insert it a little bit further so you can get that balloon inflated. If it's a straight catheter, you want it to go in and be far enough into where it's not going to be pushed out, but you don't have to go quite as far. So catheterization is a real issue. So here we have a picture of a bladder. This happens to be female, but it's no different from the male. This is a Foley. There's an inflated tip here, okay? And the urine simply flows out and the bladder collapses, okay? Oh yeah, it'll fill up partially. It'll the urine won't continuously flow probably, but the bladder will fill up to a certain level because the tip is actually going to be up above. There'll be a little pool around the tip because it's sticking up into the bladder. So it won't. So some can accumulate until it reaches the tip of the catheter, and then it can start flowing again. So you get infections because despite our best efforts, it's virtually impossible not to have some bacteria. And bacteria bacteria can be, especially if you've got a patient who's catheterized and has a kidney infection, well, you've got bacteria. But they get infected because it's virtually impossible to ensure that nothing goes in. And they start growing. In some cases, we can start seeing bacterial antigens almost right away, and that's probably because the bacteria were on the patient and they've just gone inside. It's hard. I mean, we can't sterilize a patient. All we can do is clean them as best we can, which is why we use both cleaning pads and betadine. We really. Pardon?
The sterile soap that you use for surgery?
That's the sterile soap. Betadine is a sort of a soap. The iodine is a disinfectant that's in betadine. That's what the dark color is, that red color, purple color. That's iodine. And it's a pretty good antibacterial, but it's also has its other problems. Stains like crazy to begin with. But we use both. What we're trying to do is make sure that we do a really good job of cleaning the patient so that we can do our best not to introduce bacteria. But almost inevitably, it will get introduced. Remember, we've got a tube on a structure on the surface of the body, and that tube itself is a conduit for other bacteria. We can't keep the patient clean all the time. We'd have to be in there every half an hour cleaning them up, and we don't have the personnel for that, right? So we'd have to be in there all the time. So these are a conduit into the body, and that's why we get these infections. So this is a diagram of part of the material here. These spikes are for irrigating the bladder to try and clean it out. We often will try and put some sort of antibiotic into the bladder if we suspect if we're dealing with a kidney infection or something like that, we'll introduce antibiotics into the system through a catheter sometimes. Okay? So that's basically how it works. Questions? Okay. So it is now 6:47. Okay. So what we'll do is we'll go back to module 3. Take a quick look. So module 3, again, we've got our discussion, assignment and assessment. We're going to do the influenza A and B and the rapid strep screen. Those will take us probably 20 minutes in the lab. We've got these videos on catheterization. As I said, I'd like you to watch those on your own, but they're actually pretty good. The people doing the explanation are very careful. They're slow, a lot slower than you will be if you're actually doing this, but they want you to know what in the world you're doing, which is a good thing. And then you have the catheter-acquired UTI and long-term care Medline University course. So that you'll take, this week as well. And before you take the quizzes for the female and male reproductive system, we talked about those systems on Monday. I don't know how much Brandy actually remembers. I'm not sure how much you remember with all the pain you were in. Pardon? Okay. Well, the videos are kind of short, so you probably can review those as well, so that you can do as well as possible on the quizzes. The assessments for this week, I've made sure that they are no time limit and 3 tries. So, because we want you guys to learn this stuff, and I've told you my philosophy about these quizzes. So why don't we take a break, and then we'll go into the lab. Then we'll come back and you'll do your diabetes presentation. I looked at it. Looks really interesting. Good. So you'll do your presentation, and then we'll get going on doing assignments and catching up on work. Okay. All righty. So let's take our break.
I know. I've noticed that too. Even when I'm doing